graduated from the College of Medicine, University of Lagos in 1997, proceeded later to the USA for a postgraduate course. He's worked for the Lagos State Health Service Commission at the Pediatrics Department of various hospitals, Marcy Street Children's Hospital, Ekpe General Hospital, and Onikon Health Center, till he retired in May 2016 and then joined the Sickle Cell Foundation Nigeria. He is also the pioneer founder of the Pediatric Sickle Cell Clinic of Ekpe General Hospital, which was founded in 1992, and also the pioneer founder of the Sickle Cell Clinic of Onikon Health Center, Lagos, and he's also has a specialty as well in genetic counseling in sickle cell disorders, and of course his interests are care and management of children with the sickle cell disorder. All right, so today, again, just like weeks that have gone by, and in fact a whole quarter has gone by, we always try to look, and delve into the sickle cell, matter, the disorder, the environment, the situation, and all that actually comes with it. And every day we come, and every day we listen, one revelation or the other, is always met. Just like last week, and a lot of people were just, taken aback and really surprised at some of the revelations that Dr. Alakija, bared before us. Today, we're talking about correct diagnosis. Am I correct?
Accurate diagnosis of sickle cell disorders.
Okay, accurate diagnosis of sickle cell disorder. Now, I'm not sure how this conversation is actually going to go, because I'm wondering if we say, correct diagnosis of the sickle cell disorder, I want to believe it might just be also, apart from we the patients, or, we who are looking to actually know if our children or ourselves, have the sickle cell disorder, I want to believe that also on the part of the experts or the supposed experts, they have a role to play in also making sure that they give correct diagnosis to patients who actually come to them. Am I correct?
You're correct.
So what's the first thing to know about accurate diagnosis of the sickle cell disorder?
Thank you very much. Like in any disease, in any sickness, we, the doctors, we want to be sure exactly who we are treating, what we are treating. That will help us to prescribe the right prescription and the right management. In particular, in sickle cell disorders, it's important that we are 100% sure, that is accurately sure, that this person has sickle cell disorder. It will help us to prescribe the right prescriptions that will help the patient live longer, live healthier. As we go on in the program, you'll see that sometimes it's a question of life and death if you don't make accurate diagnosis.
Of course.
And sometimes it's not just a question of life and death. The morbidity is also there. It's not just you live long. How are you living long? Are you living healthy? It's not just, I live till 80, but how well are you living? So everything is hinged on making the accurate diagnosis.
Okay.
And as we go on, I'll let you know that if you don't make accurate diagnosis, there may be very many problems, social problems in particular, and medical problems. So we are looking at the two issues: the medical implication of making accurate diagnosis, and the social implication of making accurate diagnosis.
So before we look at the implications, really, let's look at the first steps to actually take towards achieving an accurate diagnosis of a sickle cell disorder. As an individual who actually wants to go to the hospital or a clinic or whatever it is that, I'm seeking for this diagnosis, is there something of note, to actually take into cognizance that, okay, this is a place I know that if I go to, because the thing is, we cannot know. We believe in you, the doctor, what you tell us, and then we take it home until, another event takes place. So what should we do on our part? Are there places that you say, places like this, don't go to the place, or you see a certain equipment, ask them not to use it, or something? What is our role to play?
Now, your role is, number one, to know that you need to know your genotype. Most people are ignorant of their genotypes. Most people don't even know that it is important for their health. It's important in their marriage. It's important in the children that they bear. So the first thing is to be let the public be conscious of the fact that whoever you are, is good to know your genotype for very important reasons. Number two is that, well, your question is that where should I go to get a good, correct, accurate diagnosis? Unfortunately, most of the laboratories, some of them give what we call wrong diagnosis. And it's not because they want to give wrong diagnosis. Sometimes, sometimes the procedure itself they mistakenly give wrong diagnosis. And by mistakenly giving wrong diagnosis, it has implications for them, for the children they are going to give birth to. And so I will say that it's not so much a fault of the patients themselves that wrong diagnosis is given to them. Once you go to the laboratory, a good laboratory, you believe they will give you a correct diagnosis. But sometimes, because of the machineries and other things involved in actually bringing out the diagnosis, errors come in. But where we are so concerned is that the patients, everybody must make effort to know his or her genotype.
Okay, so would you encourage every patient out there who is seeking to know their genotypes to actually, make 2 rounds or 3 rounds of it? Because I'm not sure that is common. What is common is when people go for HIV tests, and maybe oftentimes is when it comes out positive, and then you say, oh no, I want to get a second opinion and then a third opinion. So would you advise that for, checking your genotypes, do not depend on one finding, but seek another?
What we advise is that when you go to any laboratory to try and know your genotype and they bring it out, it's good for you to reconfirm maybe 2 other places so that you are very, very sure they are coherent. A laboratory may give you a genotype of AA. You may find that some other time the same patient goes to another one and they give him AS. And so there's like a little dichotomy there. So it's important. I remember a time that I was at the Unicon Health Center. A patient was brought. And just looking at this patient, a little boy of about 5 or 6, I knew that this is probably a sickle cell kid. And I sent the blood to the laboratory, and they came out and told me the child has AS. And I said, no way, this is sickle cell disorder. I said, laboratory man, can you repeat it? He said, okay, doctor, I'll repeat it. And they went, repeated it, and they came back, hey, we're sorry, it's SS. So we find this kind of thing once in a while, that due to the laboratory people. But most of the time, however, when you reconfirm 2 other places, you get 2 at least out of the 3 that give a consistent one.
Okay, so finding our genotypes, or knowing what our genotypes are for the sickle cell patients, is that the only way to actually discover if they have the sickle cell disorder or not? That's the only way?
Yes.
You have to know your genotype?
Oh, yes.
Okay. All right, so we might just want to look at the implications now on both sides, both the laboratory and, the implications on the health of the patient.
Okay. Now, the first thing I'd like to say is that you need to know the correct diagnosis of your genotype for at least few reasons. Number one is to prevent marital conflicts later on. When a couple marry and the child is born and begins to manifest symptoms early, and they don't know what is this, and they come to us and we say, let's test the genotype, and we find it's SS, and we say, your child has sickle cell disorder, and they're wondering, what is sickle cell disorder? And one of them, maybe the father says, we don't have this kind of thing in my family, I'm AS. But what do you mean sickle cell? And I explain to them what sickle cell is. And then I tell them, well, it's not the fault of your wife. He is trying to blame the wife. That it's from the wife's family this must have come. They don't have it. So, but when you do a correct genotype and you ask them to repeat it, and the father comes, he's AS, maybe the woman does her own again and it's AS, and you explain to them that you are AS, your wife is AS, and the child has taken S from your own genotype, has taken the S from the mother, and he has combined the 2 S, and his SS. Now they can see properly that each of them has contributed to the child genotype. It's not the fault of anybody. But without this explanation, they begin to blame each other. So correct diagnosis also helps them to blame each other. Again, some sicknesses look like sickle cell disease in their manifestation.
Really?
Yeah. And if you don't know that this is sickle cell, you will make a wrong diagnosis, wrong prescription. For instance, somebody may come with pain in the joints, pain here and there in the leg, and maybe he doesn't know his genotype, correct genotype, and the doctor himself hasn't checked the genotype, and the doctor will probably think this is arthritis and begins to give him Dosage, Feldine, all those kind of anti-arthritic drugs. But whereas this is a sickle cell case, showing symptoms that look like the other one. So, but when you know that this is not just arthritis, this is one of the complications of sickle cell, you manage appropriately. A patient, for instance, may come with acute pain in the abdomen, and it looks like a simple acute abdomen, but and you don't know that this is a sickle cell manifesting with a crisis in the abdomen. I've seen that case many years ago. I was at General Hospital, Lagos. Somebody came with what the doctors felt was acute abdomen pain, severe pain, and they operated the patient, not knowing that this is ordinary crisis, abdominal crisis of a sickle cell patient. So they don't need to operate. All they need to do is give a lot of fluids, give antibiotics, give a painkiller. And it was later on that the parents volunteered the information. My child is a sickle cell, and they said, we didn't know. So sometimes wrong prescriptions, not to make wrong diagnosis.
So how did those doctors not know? Is it not
the doctor should have checked the genotype of anybody they want to operate on, but maybe it slipped their mind and they thought this was an acute emergency, and they did the operation, and behold, they found nothing.
That's an acute mistake.
That's an acute.
Oh my goodness. Before you go on Lagos, you can actually be a part of the conversation. The number to call is 0700 923 923 923. You can also join us on our WhatsApp platform by sending us a message. Share your thoughts with us on 0817 313 6193. Correct diagnosis in sickle cell disorder is what we're talking about. Have you been actually a victim, one who has gone through series of tests in the laboratory and then come out with one result, only to find out later that the results that you've carried on your chest all your life is nothing but just a shamble or a charade? Share with us this afternoon. The number again is 0700 923 923 923. Hello, good afternoon. Good afternoon, sir. Please, what's your name and where are you calling us from? All right, Jude, talk to us.
Number one, there's no change of genotype. Are you hearing me, sir?
Yes, he can hear you.
The genotype doesn't change. The one you are born with, you maintain for the rest of your life. Like I said, there are errors in the laboratory, and it's not deliberate. Some of the solutions and the techniques, they make some mistakes. Even the very good one, we call it the hemoglobin electrophoresis method. That one is one of the best. It still has some errors. It can make some mistakes along the interpretation. We know so the various laboratories that you said, one gave you AA, one gave you AS, one gave you ASC, and so on and so on.
That's a lot.
It's mistakes. It happens. And so what I'm trying to tell you is that try to check from reliable, good, teaching hospitals will be a better place. Any teaching hospital. Luth is there, Lasut is there. Our own foundation, Sickle Cell Foundation, I can vouch for it, not because I'm working there. I can vouch 99.99% that whatever we give you is correct. But still, you can even check at other places too. But the bottom line is that don't go to all these peripheral laboratories, Ajegunle, Namibi, the Ghana Must Go Hospital. Go to teaching hospitals, Lasut, Luth, or Sickle Cell Foundation. I can recommend those. Thank you very much.
All right, Jide, I hope you got that, but those were lots of entries, really, and I'm sitting here and I'm wondering, how are you sure which is the correct one? So the last one to come out, if it's favorable, I might as well just claim it, whether it's correct or not, and it's really scary, and I'm thankful that you eventually answered what I asked you when I said, how do we know where to actually go get the right one? Teaching hospital, as you say, is your best bet.
Yes.
All right, Lagos, it's 20 minutes gone past the hour of 192.3 Inspiration FM. It is still Surviving Sickle Cell, a show in partnership with the Sickle Cell Foundation Nigeria, and yes, also in honor of the memory of our beloved Tosi Buckner, who is one of us, I would say, but passed on, yes, November 19 last year. We're going to take a short break now. When we come back, we'll still be talking about implications. What happens to me if I find out that I actually have the sickle cell disorder, and all this while I've been diagnosed to have what, AS or maybe AA or like GDSC. I don't know what's going on. But what's your story? The number to call to get through to us when we come back from the break is 0700 923 923 923. My name is Thelma Illens, and I'm doing this with Dr. Tunji Alakija, a medical officer working with the Sickle Cell Foundation Nigeria, Idaraba, Surulere. Don't go away. Before we step aside at 1:30, Surviving Sickle Cell, yes, that's the show that you're listening to, and we have been talking about myself, Thelma Illens, and Dr. Tunji Alakija. We have been talking about correct diagnosis in the sickle cell disorder, and yes, while before the break we took a call, and right before that we were looking at implications, regarding incorrect diagnosis, as the case may be, in this regard. And you had started off really pretty well, but I'm sure there are a couple of other implications that you might want to look at.
Okay. Now, sickle cell disorder has many complications, like we all know. One of the complications is what we call priapism. Priapism. That is unwanted, sustained erection of the penis.
Okay.
It happens in men,
male.
Young men, 12, 13, 14, teenager.
Okay.
Now, if you don't make a correct diagnosis, if somebody presents with that, and you don't make a correct diagnosis, it means that you are going to be given wrong treatment.
Yeah.
But if you know that the patient is SS, it's not like AA, or he doesn't even know his genotype, he just comes with a problem, you will not make the correct diagnosis, and it may lead to complication, deeper complication, sometimes even death. I've seen a case at Akbe General Hospital where somebody came with priapism, and he's been having it for about 2-3 days before they came. And I said, oh God, Papa, why did you wait for 2 to 3 days? They said they've been to one native doctor, and when that one couldn't, they referred to General Hospital like me. I said, hey, you're joking with impotency. Because if you don't relieve that thing within 24 hours, a maximum priapism, the person can remain impotent for the rest of his life. So we can see that it has very, very grave, sometimes again, somebody comes with ulcer of the leg. Now, sometimes it's not a simple ulcer. Now, you may want just to be treating simple, giving some antibiotic and dressing. But sickle cell disease has one of the complications as chronic leg ulcer. And the management is different. So if you know that this is an SS patient with chronic leg ulcer, we know what we give to make sure that the patient doesn't go off. But if you don't make the correct diagnosis that this is a sickle cell leg ulcer, you may lose the leg. Amputation of the leg may happen. So you can see why it is important to know the diagnosis and to have accurate diagnosis also. Again, another thing I would like to say is that young boys and young girls in secondary school, they need to know their genotype. Because if they don't know, some of them may not make informed decisions concerning marriage later on. But when you do it for them and they know, maybe a young girl of 16, 15, oh, I know that I'm AS. And you let her know, you inform her all the various options, then she can make a good informed decision who to marry. You let her know that if she marries somebody with S, there's a possibility of having a sickle cell. So it's important not only to know what your genotype is. Another thing I will say is that young mothers who are sickle cell SS, if you don't make the correct diagnosis for young mothers and they are pregnant, they may have great problem. But if you know it's an SS mother, she's pregnant, there are different cares we give to them to make sure that they deliver the baby safely and they are alive. But if you don't know that she's SS and she's pregnant, she may lose the baby, she may lose her life, because there are special cares for mothers pregnant who are SS. Again, I find that if you don't have the correct diagnosis, you may not institute correct information to them. We call genetic counseling. If you know that this mother is SS, you will let her know that, hey, SS mother, you are pregnant, limit your children to 2. But if you think she's AA or AH, you will not advise her. She may want to have 3, 4, 5 children, which is against what we preach for mothers who have SS, who are pregnant. We ask them to limit their children to 2. Because number one, sickle cell is problem itself. Pregnancy is another problem. So for a sickle cell mother to think she can have 5, 6, 7, she's endangering her life. So these are some of the things we, and then again, secondary school boys who are SS, they need to know that certain things will worsen their problems, will give them more crisis, which will lead to death. But if you think a 15-year-old boy, secondary school boy or girl, is not a sickle cell, you think he's AA or AS, then you will not give all the information needed to stop crisis. For instance, if you go to a secondary school and you find that some of them have sickle cell disease, you let them know that things like stress, physical stress should be avoided, it can lead to crisis. Mental stress should be avoided, it can lead to crisis. Infections, trauma, cold weather, changes of weather, especially cold weather, malnutrition, dehydration. Now, when you stomp them with all this kind of information, they know, these are things that can bring crisis. I need to be aware of and caution of it. So these are some of the reasons why we say that we need to make not only diagnosis, but correct diagnosis of those who have sickle cell.
Okay, so because of time, can we look at the implications on the other side? You know, the experts, or the supposed experts, you know, on the part of laboratories who actually give wrong diagnosis.
Now, what I will say is this. We need to have well-trained laboratory technicians who know exactly what they are doing. And we need to have good instruments available that can make correct diagnosis. The incidence of wrong diagnosis will be far reduced. I don't want to blame all of them, but a few of them should be blamed for not doing the correct thing. And in good countries abroad, affected people can sue the laboratory for giving them wrong diagnosis. Because if somebody dies because of wrong diagnosis, you can sue them. If the marriage is disturbed, because in some cases you see that they want to divorce each other because they are now having sickle cell children, which if they had given them the correct diagnosis, you are AS, you are. Some of the ladies tell me, if I knew that my husband was AS, I would not have married him. Because some of them will say, I know I'm AS. When my husband came, he showed me his result that is AA. And that's why I married him. I said, but now when we have sickle cell children, he did it again, he found that he's AS. And I said, if you had known at the beginning that he's AS, what will you do? Most of them will say, I will not marry him. So these are the implications, and I think we need to take it seriously.
I'm afraid, Dr. Alakija, we're out of time. Thank you so much. I appreciate you for every time that you come here and you throw a lot of insights. We look forward to another edition, next Saturday by 1 p.m. It has been Surviving Sickle Cell, your #1 family radio station, a show in partnership with the Sickle Cell Foundation Nigeria, from where the medical officer, Dr. Tunji Alakija, is from, and the national director, Dr. Yes, who's still away, but she'll be back soon. Looking forward to having her back. My name is Thelma Ilams. I'm leaving you with this one. Show love by rubbing. It's what every single person whom you meet out there whose head is somewhat down, all they just need is love. I'll be back here on Monday at 11 a.m. for the tea break. In the meantime, have yourself a beautiful weekend.